Case study number 2 for video post HSC 250. Case study 2-1, displaced fracture of the femoral neck. While walking home from the train station, MA, a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. MA was prepared for surgery and given a preoperative injection of analgesic to relieve her pain. Intraoperatively, she was given a spinal anesthesia and positioned on an operating room table with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case study 2-2, intertrochanteric fracture. AR, age 88, slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. AR had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiograph showed a non-displaced right intertrochanteric fracture. Intraoperatively, Mr. R was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compression screw and side plate with screws. His postoperative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Case study questions. Write a word from the case histories that mean the same as each of the following. Replacement of half the joint component is reduction. Substances that act against microorganisms is antibiotics. In a position away from the midline of the body is abduction, and position toward the midline of the body is adduction. Identify and define the prefixes in the following words. Displace and dislocate, the prefix is dis, the meaning of the prefix is away. Replacement and rehabilitation, the prefix is re, which means back or again. Avascular, prefix is a, and that means without or lack of. Anesthesia or analgesic is an, which is without or lack of. Orthopedic, prefix is ortho, which means straight. Externally, prefix is ex, meaning is out of. Bipolar, prefix is to, bi with the meaning of to. Unremarkable, prefix is un with the meaning of the prefix being not. Fill in the blank. The adjective for the operative time span for decision for surgery to placement on the operating room table is preoperative. The adjective for operative time span from placement on the operating room table until transfer to post-anesthesia recovery unit or intensive care unit is intraoperative. The adjective for operative time span from admission to post-anesthesia is postoperative.